Hi, my name is Rebecca Moore, and I'm the Stroke and Heart Attack Coordinator at Hilo Medical Center. You're about to see a video of Grandma Jean, one of our stroke survivors. We want to make sure that you know what to do when somebody is having a stroke. So we're going to show you what happens during a stroke activation from the time the patient has their symptoms to the time they get to our hospital. So we can get patients treated quickly because time equals brain.
Jean is getting a glass of water when she suddenly loses strength in her arm and leg. She becomes dizzy and nauseous and sits down to catch her breath. Jean is having a stroke. A stroke occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or bursts. When that happens, part of the brain cannot get the blood and oxygen it needs, so it begins to die. Stumbling and upper arm or lower leg weakness are some of the most common signs of a stroke, and a 4.5-hour timer has now begun for Jean to get treatment. The sooner Jean can get to an emergency room, the faster she can receive the care she needs to avoid losing brain cells. Thankfully, someone notices the symptoms of a stroke and immediately calls 911 to report an emergency. Always call 911 instead of driving yourself or being driven, as treatment begins in the ambulance. EMS is able to get to Jean within minutes and begin assessing her symptoms. Hawaii EMS uses the Los Angeles Pre-Hospital Stroke Screen, or LAPS, to identify potential stroke patients before they reach the hospital, which includes asking a patient's age and medical history and checking grip strength or arm strength and drooping of the face. In the ambulance, a blood glucose test is administered and vital signs are taken. Jean is showing all the symptoms of a stroke, so EMS radios in that there is a LAPS-positive stroke patient incoming.
Patient advisory on board, I have an 85 female, possible CVA, stroke coming in.
Hilo Medical Center acknowledges the call and begins a stroke activation.
Stroke team activation, ETA 5 minutes, trauma room 8.
An emergency room is cleared, as well as the CT scan machine. A CT scan is critical to diagnose exactly what type of stroke is happening. As soon as Jean gets to the hospital, a clerk registers her as a patient and she is brought immediately to the CT scan room. Within minutes, a CT head scan is ordered and given express priority. The images are sent directly to a radiologist who will determine a course of action for the Hilo Medical Center to take. Soon after the scan is complete, Jean is transferred to an emergency room, where a new set of vital signs are taken. A neurological exam is given to test consciousness. Questions include knowing your name or birth date and identifying everyday objects to check for slurred or confused speech. A physical exam tests strength and physical sensation. These tests are part of the National Institute of Health Stroke Scale, which helps identify stroke severity. Once the test is concluded, medical staff can determine whether or not to administer stroke medication. 1 in 4 stroke survivors will experience another stroke sometime within the next few days, so Jean will be kept at the Hilo Medical Center for observation. Because Jean received treatment quickly after first experiencing symptoms, she is alive and well to share her story.
My name is Jean, and I had a stroke, but thanks to my granddaughter, she noticed that one side of my face was drooping, and she asked me if I was sick, and I said, no, I'm fine. Go to work, you know. And just half an hour later on, that's when I had my stroke. And when I had the stroke, it was a different kind of feeling. I felt like throwing up. And you feel this weakness in your hands and your feet. I hear this commotion in the hallway, and I hear my granddaughter's voice, and here the paramedics took me out. First thing they did after they put me in the ambulance was to take my blood pressure, and it was over 200. And he said, yep, I think you had a stroke. It's scary, it's scary. So if people are aware of this, lots of people can be saved.
I hope this video brought a lot of stroke awareness to the community And remember, if you think your loved one or yourself is having a stroke, please call 911. The stroke signs and symptoms, I want you to remember B fast. So B stands for any balance issues or all of a sudden dizziness. E stands for eye vision loss or blurred vision. F stands for facial weakness. A stands for arm weakness. S stands for speech problems, and T is for time to call 911, because we only have a certain amount of time to treat your stroke, and the quicker you can get in, the more brain we can save. And please remember that Hilo Medical Center is here to care for you on your worst day.
They saved my life. Instead of waiting, call 911.